Recently, at Hackensack Hospital's Hackensack Hall took place a fascinating panel discussion titled Healthcare in Armenia 25 Years After. The panel discussed challenges and future directions of Armenian healthcare and diaspora's participation in improving it. The panel opened with welcoming remarks by Assistant Professor of Nutrition Dr. Kim Hakkimian, who, after reading acknowledgments for the event's organizers, introduced the panel speakers. They included Vartuhi Petrosyan, PhD, Lucy Tovmasyan, MD, Dr. John Belizikian, and Dr. Shant Shagardimian. In her presentation, Dr. Kim Hakkimian gave a definition of public health, which includes identifying health problems, planning and preparing for health emergencies, environmental, food safety, disease prevention, and other public health factors. She dispelled the myth that Armenia is a third world country and presented charts and statistics for several health indicators of Armenia compared to the United States. For example, the life expectancy in Armenia is only 5 years shorter than in the United States. Similarly, infant mortality in Armenia has steadily declined since 2001, and maternal mortality in 2004 was in par with other advanced Western countries. According to the data, the leading cause of death in Armenia remains to be cardiovascular disease, caused by tobacco use and poor diet. The latest statistics on tobacco use in Armenia is a matter of great concern, with over 78% of never smokers regularly exposed to secondhand smoke, and 54% of households have someone who smokes. Also, child malnutrition in Armenia remains high, causing numerous problems, including stunting. Dr. Hakkimian also touched on other interesting statistics, including metabolic risks factors, fertility rate, pregnancy outcomes, and contraceptive prevalence rate, among other topics. She also spoke about the key obstacles to improving healthcare in Armenia, particularly leadership training and cultural mentality. Dr. Hakkimian also dispelled the myth that nothing has changed in Armenian healthcare. In fact, there's been a dramatic improvement in health legislation and regulations, and there has been an increase in the agnostic equipment in Yerevan and in regions. But she stressed that there are many challenges remain, particularly in the sphere of medical education.
25 years have passed of independence. Terrible years in the beginning. A lot of progress has been made, but we wondered, could the diaspora do better? Could we coordinate our efforts in such a way as to go to the next level and make our contributions to Armenia more cost-effective and more impactful on the population? One of the roles that the diaspora can successfully play in improving healthcare in Armenia would be to provide education and training starting from the medical school.
Dr. Vartuhi Petrosyan, Professor of Health Science and Dean of Gerald and Patricia Turpanjian School of Public Health of American University of Armenia, arrived from Yerevan. She spoke about health system and public health issues in Armenia. Through a series of informative data and statistics, she underlined the weaknesses and strength of the Armenian health system today. She also touched on reported cases of tuberculosis in Armenia and talked about the counseling pilot program for parents and family members of patients infected with TB. In her presentation, Dr. Petrosyan also touched on numerous other health-related subjects, including a list of major health reforms in Armenia since 1994, providing health benefit packages to the citizens of Armenia, and improving nursing education.
Last time I presented a project on tuberculosis control, and since then, that project inspired us to implement a very bold, innovative project in Armenia on TB care, which could change the practice of care not only in Armenia but globally. This project was supported by the Canadian government, and it gave seed money, and we were the only organization in the European region to receive money from this organization to do this project. It's going to help many low-resource countries to improve the way they treat their TB patients. And after that, we continued our collaboration with a diaspora and Armenian organization, the Armenian Medical Fund. And we started a continuous quality improvement project with the National TB Control Center. And we completed the needs assessment stage, based on which we developed a 5-year plan of implementing steps that would improve the quality of care significantly and would help the Armenian TB Control Center to become a center of excellence regionally, where the other country representatives would come to Armenia to learn how to do things properly and how to improve tuberculosis care in their countries.
Dr. Tovmasyan, obstetrician gynecologist, spoke about the state of rural healthcare in Armenia. Drawing from her personal experience in working in rural Armenia as part of APO's outreach mission, Dr. Tovmasyan described the condition in several clinics. This included Aragats, Lori, and Alaverdi clinics. She described lack of education for medical professionals and patients, outdated equipment, and discrepancy in quality of care outside of the capital as major difficulties in rural medicine.
So one of the things we did between my first year going and my second year going is try to keep a registry of all the women that came to the clinic to get their pap smears, so that we can keep track not only of who got their pap smears, but whether or not they were coming back for follow-up subsequently. And if they got an abnormal result, did they go to Yerevan or Armavir Hospital or whichever hospital they were assigned to get whatever treatment it was they needed. On average, the average woman in the villages of Armenia does not get a mammogram. It still costs about a month's salary to get a mammogram. So even though, we do have more mammography machines available, it's still not widely used because the cost is so high in comparison. And also, these people in these villages, especially the more remote villages, cannot leave their work. They can't leave the field to go because they lose. That's their lifestyle, their money. They can't leave to go to these centers where they can get these mammograms. So there's access in the villages is still a big issue.
At the conclusion of her presentation, Dr. Tovmasyan spoke about the upcoming 2017 APO Armenian Medical Mission Program and invited anyone interested in joining the program to check out APO's Medical Mission Facebook page. World-renowned Dr. Bilizikian opened his presentation with an announcement of 2017 Mission of Osteoporosis in Armenia, which will include participation of medical professionals from Armenia, Russia, and former Soviet countries. He described osteoporosis as a global problem affecting 200 million women and men worldwide. In 1986, a bone density machine, DXA, was invented that changed the diagnosis of osteoporosis forever. As of 2007, 20 years after the DXA became widely used throughout the world, Armenia only had one machine. Inspired by the words of legendary Armenian-American neurosurgeon Dr. Hosepian, Dr. Bilizikian decided to change the statistic.
I began my journey to place DEXA units in the country. The first unit was placed at the Makarian Hospital, then an ultrasound machine was placed at YSMU, a DEXA machine was placed at YSMU, then we had major software upgrades for all DEXA equipment that we had placed. Over the next 3 years, DEXA units were placed at the Erebuni Hospital, the Traumatology and Orthopedic Hospital in Gyumri, and in Stepanagar. And this past year, we were able to place 2 more units, one in Vanadzor and one in Kapan. And some of you will say, well, where did you get these $100,000 machines? All I did was call the company and tell them what I wanted to do, and I was lucky that they bought into this idea. When I called last year, they said, "You again? You want another machine?" I said, "No, I want 2. Now, 10 years later, Armenia has risen from the bottom of the list of countries with DEXA capability per capita. We were at the bottom of the world's list to now where we are above average in rankings of such instruments in the world.
Dr. Bilizikian listed many educational symposiums taking place in Yerevan on the issues of osteoporosis, including involvement from Columbia University and Boston University and other renowned medical institutions. The 2017 Mission Osteoporosis Armenia Symposium will include programs for local physicians and hospital staff, development of local expertise in osteoporosis, and development of working relationship with Ministry of Health. Dr. Belizikian concluded his lecture with a hope that in the near future Armenia will become a center for osteoporosis referrals and for education throughout the region.
Osteoporosis conference that we had in October last year, there were actually 3 conferences. The first one was an international summit. There were a total of 14 countries all coming to Yerevan to talk about osteoporosis in their countries and to share their experiences. So this was really a very, very important event because beyond the educational value, it identified Armenia as a center of interest on the part of all these other countries. The other conference we had was our annual Osteoporosis Symposium, and this was our 10th annual conference. We used the main hall of the American University of Armenia that holds over 800 people, and I thought at one point the hall was completely full. As far as the future for Armenia, I think that we have to start at the basics. I think we have to look carefully at the medical education and hopefully move it to a point where training is adequate. If we can get young doctors to graduate from school and have really good fundamental training in medicine, then I would be extremely optimistic.
General Surgeon Dr. Shan Sheherdemian, who arrived from Los Angeles, started his presentation, Building Systems versus Saving Lives, with an example of a single patient, little boy named Tigran, who a few hours after his birth suffered a serious health complications. His parents were told that he had few hours to live, but family decided otherwise, and selling their home and other possessions kept little Tigran alive. Through Facebook, Dr. Sheherdemian heard about this boy and decided to help. In a period of 2.5 years, Dr. Sheherdemian provided his medical expertise to the family and traveled to Armenia on several emergency calls. Thanks to his efforts and help of many others, 3 years later, Tigran was able to fully recover. However, shortly, the family was forced to permanently move to Germany simply because they did not trust the healthcare in Armenia. This story underlines the amount of work that still needs to be done to improve the healthcare in Armenia so children like Tigran don't have to leave the country. Determined to find a solution, Dr. Sheherdemian spoke about the importance of creating sustainable healthcare system in Armenia that is designed for the unique needs of that country, so children like Tigran can come home.
25 years post-independence, that we should start recognizing that the buck doesn't stop here with us as a diaspora. We really should start to look at ways of climbing this ladder and becoming an effective stakeholder and a partner in sustainable development of healthcare in Armenia. And this is not about the problems of healthcare in Armenia. Every single healthcare system in the world, including ours, has major problems. So it doesn't even matter what the problems are. It's about the approach. When I went to college and when I went to medical school, and this was briefly after the war and the earthquake and the independence of Armenia. I can't tell you how much I was inspired by the generation before us, what my parents thought were impossible. I can't tell you how much I'm inspired by people like Harut Armenian, who had the vision to develop an American university in a country that was Soviet for 70 years before that. Who would have even thought of that? Who would have even thought that that was a possibility? The people who sent over the dialysis machines and put them up in Gyumri with no electricity in a Soviet healthcare system they knew nothing about, risking their lives, taking those machines through Chechnya on Russian cargo planes. Those were my inspirations. But the question for me, and that I ask myself and that I want to have an answer to for my generation, is what is going to be our generation's legacy? How are people that come after us, how are they going to be inspired? For me, I'd like to know that I've been a part of building a system and strengthening a system that is capable of bringing Tigran back home to Armenia.
Սփյուռքի կողմից, մեր կողմից կարծեմ ամենակարևոր քայլերից մեկը այն է, որ մենք համախմբվենք, ոչ թե համախմբվենք, որ մարդկանց հին պրոջեկտները մոռանանք եւ այլն կամ նոր բան ստեղծենք, նոր կազմակերպություն ստեղծենք, այլ կարողանանք մենք միասին աշխատենք եւ սկսենք աճակից լինել Հայաստանի մեր բժիշկների, մեր գործընկերներին, որ բժշկության հիմնական խնդիրներին սկսենք միջամտել եւ փորձել բարելավել։ Կան շատ մեծ եւ լուրջ խնդիրներ, որ մնացել են սովետական ժամանակներից եւ դժվար է այս մարդկանց մտածելակերպը եւ այլն փոխել, բայց ասեմ, որ Հայաստանում մենք նաև ունենք գործընկերներ, որ զարմանալիորեն մեզնից ավելի շատ արագ փոխվում են, adapt են անում, սովորում են եւ մեզնից ավելի հեշտությամբ կարող են իրանց սորված այդ բաները, որ միշտ իրանց գլխի մեջ ծեծված է, իրանք թողեն այդ դրանք եւ անցնեն ավելի արագ դիմության։ Շատ մեծ հույս կա, շատ մեծ potential ունենք մենք առողջապահության մեջ, Հայաստանի մեջ անպայման։
The panel discussion ended with an engaging Q&A that lasted long into the evening. Since the quality of healthcare for our compatriots in Armenia remain one of the most important challenges facing our nation today.